Welcome, ladies and gentlemen. I'm Dr. Silva. Thank you for joining me for this talk on oscitation, the side effect of yawning. Oscitation, from the Latin occitare, to open the mouth. This is a very interesting side effect. It's poorly understood and it's infrequently reported. I think the incidence of it is greater than what it seems. It's in fact not an uncommon side effect. I think it's simply one that's so short-lived for most patients, and it's usually not very disruptive or very severe, that patients simply don't report it. Because one, perhaps they don't even associate it as a side effect. They may or may not notice that they're yawning a lot, and if they do, they might assume they're just tired and never put two and two together and realize it's the medicine that's causing it, especially when they may actually be feeling tired and even sleepy because of the medicine. And also up at night because of the medicine. Two separate, independent side effects, and both unrelated to yawning, as it turns out. And two, for so many, it gets better so quickly. But the actions of serotonin on the brain do cause the direct side effect of yawning. Again, not associated with any lethargy or somnolence the patient may be experiencing for any reason, or that might be due to insomnia as a separate consequence of the medication, or else the direct sedentary somnolence that people feel during the day, regardless of how well they slept the night before, whenever they take a seat at their desk or on the couch, and the increased serotonin causes them to actually feel sleepy when they're sedentary. That is, not moving about, and especially when they're recumbent. That is, in a non-standing position, either sitting or especially lying down. Both of those are side effects as well. And so there are these deleterious effects on sleep architecture during the night, where a patient may experience a lot of middle-of-the-night awakening, middle insomnia, sometimes with the inability to get back to sleep, terminal insomnia. And then there's this sleepiness because of the serotonin. Actual somnolence. More than just feeling tired or lethargic, but actually feeling like one could take a nap, and in fact drifting off to sleep in recumbency. But those two side effects have nothing to do with the side effect of intractable yawning, because the yawns that are induced by the increase in serotonin have nothing to do with being sleepy or being tired. And this is the big misconception. The yawns that have to do with increased serotonin, that are side effects, direct side effects of increased serotonin, are not related to how well you slept the night before or how sleepy or tired you may be for any reason, including as a direct consequence of the serotonin in another vein. Patients often conflate these side effects, understandably, telling me that they're tired or sleepy, which they are, but then rationalizing that they've been yawning a lot. They often say these two things to me together when those two phenomena are separate. I tell them, you're yawning a lot because that's also a side effect of the medication. They don't realize that that's just another side effect, an esoteric one, but a not uncommon one. And just as people yawn when they're bored or when they see someone else yawning and not feel tired, yawning is often unrelated to one's level of alertness, whether it's a symptom or a side effect. We don't really know why animals yawn, why boredom triggers it, or why yawning is contagious. The study of yawning is called chasmology. It shares an etymology with chasm, meaning abyss or cleft, ultimately from the ancient Greek chasma. The dictionary app I used didn't even list this word, but the first definition for chasm was a yawning fissure or deep cleft in the Earth's surface. I just love language. Anyway, oscitation is a complex muscular reflex that involves opening the mouth and dilating the airway, Inhaling deeply, not just drawing a breath, but a long, drawn-out, and profound inspiration, stretching the muscles around the throat while the mouth gapes. I'm not going to mime that for you, but we all know what it looks like. It's not pretty. And rapidly exhaling, often noisily. It's a common behavior in many vertebrates, including not just primates, and in fact most if not all mammals, as well as reptiles and amphibians, but birds and fish as well. How do you know a fish is yawning? Apparently because yawning is associated with gaping of the mouth and a rapid expiratory phase. Ichthyologists and ornithologists actually count the seconds the fishes' and birds' mouths are open. Even fetuses yawn. The act of yawning while simultaneously stretching is called pendiculation, and not coincidentally, felines are big-time oscitators and huge pendiculators. Cats are always yawning and stretching, and there's definitely a serotonergic link between these proclivities, in my opinion, as well as with other instincts seen in cats, large and small, related to OCD, obsessive-compulsive disorder, which is likewise a serotonergic condition. I keep saying I'm going to do a fun video on how cats have OCD. And while frequent giant yawns are not part of the OCD syndrome itself, there is a serotonergic connection. We've probably all noticed how felines love to yawn and are world-class stretchers, and the reason has something to do with serotonin. But more on that in a future video. Please check my OCD playlist. Some animals, such as baboons, according to Charles Darwin, apparently yawn to threaten their enemies by baring large canine teeth. On the other end of the spectrum, for penguins, yawning is part of the mating ritual. And snakes yawn to realign their jaws after a meal. It's often caused by tiredness, but boredom also triggers it for some reason. And then sometimes there's no better apparent reason than the fact that someone else is doing it, a phenomenon called echopraxia. So there may be a plethora of uses. One of the physiologic effects of yawning is an increased blood flow and thereby oxygen intake to the brain, which additionally may cool the brain. Both are theories about what drawing in those great big breaths accomplish: better oxygenation and temperature regulation. Human physiology is all about homeostasis, and so when we disrupt the balance between neurotransmitters by increasing serotonin, we induce various well-known side effects, one of which is temperature dysregulation, which manifests as hot flashes and night sweats. Those are two very well-known side effects of the SSRIs, for example. Just like the hot flashes and night sweats seen in perimenopausal women in response to estrogen withdrawal. A different pathophysiology, but the symptom is identical. Actually, technically, it's a symptom in menopause, a side effect when it's due to medication, but that's semantics. The realities are the same. During a hot flash, the brain is tricked into thinking that the body needs to cool off suddenly, even when ambient conditions haven't changed and everyone else in the room is perfectly comfortable. And this can happen while asleep. Maybe medication-induced yawning is another manifestation of temperature dysregulation. Perhaps in a similar vein, the urge to yawn involves the brain being tricked into thinking it needs to cool off. Perhaps tampering with the body's thermostat by increasing serotonin, which we know is a side effect of doing that, triggers the yawn reflex. A false alarm, but a compelling physiologic itch nonetheless. The problem is that because this itch, so to speak, arises in response to elevated serotonin levels and not any true thermoregulatory need, if indeed this is the underlying pathophysiology most of the time, it tends to persist whether a person gives in to the urge and yawns or not. No matter how many times a person yawns, this is what makes the yawns intractable. They can't be satisfied because they're not quelling what really is triggering them. And so perhaps similar to individuals who break into paroxysms of copious perspiration due to either the symptom or the side effect of temperature dysregulation, unnecessary yawning due to serotonergic medication may in some way be related to a momentary aberration in thermoregulation. The fact that people tend to yawn when they're tired or upon awakening, there may be relationships there in terms of body temperature as it varies in a circadian rhythm. It's theoretical, but there are studies that show that cooling the brain tends to suppress yawning. The thing to know about yawning as a side effect, though, is that although it may seem intractable, defined as difficult to deal with, they really aren't if you know the technique. And so there have been a few case reports in the literature of truly intractable cases, but those are rare. The vast majority of patients, I believe, underreport it because it either escapes notice or spontaneously resolves before they have the chance. Not all patients experience it, to be sure, but some that do fail to figure it out as a side effect and mention it to their doctor. The first step in taming these false alarm yawns is to recognize that they're happening, understand why, and then to be mindful. To remind yourself that you don't really need to yawn. To stop, which is easy in the moment. They're very easily suppressible, just like any tic would be. I'm not saying that the yawns are tics, but in a similar vein, when you don't have enough serotonin, patients that have Tourette's syndrome, patients that have tic disorders, or patients that take medications that upset the balance between dopamine and serotonin and suddenly they're ticking, it's very easy to stop biting your nails. It's very easy to stop picking at your cuticles or pulling your hair or cracking your knuckles or whatever it is you're doing. And similarly, these yawns, if they can be thought of to be somewhere in the same realm as tics, are very easily suppressible. However, once you're distracted, they may crop up again. When you're not paying attention, you might start to do it again because the brain thinks it needs it. And then you simply have to catch yourself and stop. And you may have to rinse and repeat a few times, however many times that takes. Usually not a lot until the spell passes because it comes in waves. It comes in little spells. And you can get set on a roll of one big, huge, unsatisfying yawn after another, after another, after another, after another. And it's so annoying. But then if you just realize, wait a minute, I don't need to be yawning. I can stop this. And you do, they stop. They stop. And again, you may have to do that a couple times. I usually do. When it happens to me, I usually have to stop myself. And then I'd start up again just as soon as I turn my attention away. And I stop myself, but I usually don't have to stop myself more than twice. And then it passes. And then it passes. Until one develops some tolerance to this side effect, which is probably dose dependent, meaning that as the dose is titrated, as the dose is escalated, the symptom tends to be more likely to occur, more severe, and may take a little bit longer to resolve. It may even recur once you've already developed some tolerance if you increase the dosage again. So it just all depends on the individual. But the bottom line is don't let yourself yawn. And that takes voluntary action. It takes awareness, insight, being mindful, and then taking that voluntary action. But it does not require superhuman effort, at least not each time that you do it. Just like taking your fingers out of your mouth when you're biting your nails. That's not hard to do. It's just keeping them out can sometimes be hard to do depending on the individual and how strong the urge is. But the urge does subside at least for a few minutes or a few hours. So otherwise they won't stop. We all know that yawning is contagious. When we yawn, not only do we inspire others, but we ourselves often have a tendency to yawn again. But it usually ends there, right, after a couple of yawns. Other people may pick up on it and begin to yawn. It's not quite clear what the mechanism would be in that circumstance, other than that it suggests that merely thinking about yawning may prompt your brain to follow suit if it's in the least bit in need of a yawn. Dogs have been known to yawn in response to their humans. But the thing about yawns that are side effects is that they're persistent because they aren't satisfying, because of that misalignment somewhere having to do with serotonin. And assuming, again, that the temperature theory is correct, not only does the yawn not correct a temperature problem that doesn't exist, but because that serotonin level remains elevated, the brain continues to feel that drive, and so you can have these terrible yawns, one after another, after another, after another, just this long series of unsatisfying yawning. It's just like when you can't stop itching, no matter how much actual scratching you do. These unnatural yawns can be prominent and persistent, but just as with tics and stereotypies, they're suppressible. It's very easy to stop yawning, to decide not to yawn, and to not give in to that urge and waiting to be satisfied by the yawn, because that satisfaction is never going to come. And so if one makes the conscious decision to stop, it's very easy to do so. Often, once a person is distracted, just as with tics, just as with biting one's nails, it starts up again, but it's not as stubborn as actual tics for those individuals who are prone to ticking. You may have to suppress a couple of yawns, but the feeling quickly subsides once you do, and it's like your brain moves on, and you typically don't have to keep reminding yourself, at least for a while. Those patients that complain that they're yawning continuously are doing so because they're simply giving in to that urge to yawn, not realizing that all they have to do is be aware that there's no need to yawn and that they can simply decide to stop. It's really not that hard. The main thing is not to give in to them, not to let them get started in the first place. Cut them off at the pass. When you start to have those yawns and you notice, stop. Cut yourself off before you get started. It really doesn't matter whether you've yawned once or just a couple of times or whether you've been doing it for several minutes. Once you turn your attention to it and stop, it really is pretty easy not to have to yawn again. So that's it. Thank you for listening. Comments are always welcome.